to the vlog. Today is episode 2 of our series on common interventions during labor and birth. So one of the common interventions, or I should say, is delayed cord clamping. A lot of times now this is considered standard care in our hospitals, but what does that really mean? Is it true delayed cord clamping like we think about it, or is it just a more delayed from what used to happen, which was an immediate?
Immediately, yeah.
Right. So delayed cord clamping, I think it's really important to kind of understand what that is. I think in Jess and I's mind, when we think of delayed cord clamping, it is waiting until the cord is completely white and limp, until all the blood has gone back to baby. It's really important, I think, for us, because the placenta actually contains up to a third of the baby's blood volume. So why is it important? What's the physiology of the placenta, and why might you want to consider waiting?
Yeah, so let's talk about the physiology of how the placenta works and in pregnancy and then right after birth. To really, because this is an intervention that's been done so commonly that we almost don't even think about it as an intervention anymore. But anytime you cut a cord, it is an intervention. If it wasn't, babies would come out with scissors in their hands, like, all right, cut my cord now. Right. But they don't do that. So the cord has a way to do this naturally. So when the baby is inside mom, it is having fetal circulation. So that means that at all times the blood is circulating through the baby to the placenta, then back into the baby. So about a third of the baby's blood while the baby's inside is always in the placenta. And this is normal and okay, because while the baby's inside, the baby's not using their lungs for anything.
Right.
They're getting all their oxygen from the placenta. So the placenta is almost acting like their lungs when they're inside their mom. So they don't need that blood inside of their body while they're inside. So when they come through birth and they're actually being pushed out through the birth canal, there's a lot of the baby's under, it's a tight squeeze. So not only is a third of that blood still in the placenta, but then a little bit more gets squeezed back out of the baby and into the placenta. And this can be even more true if you have maybe like a traumatic birth, like a shoulder dystocia. Some more of that blood can be squeezed back into the placenta. And so nature made it that when baby comes out, that placenta and the umbilical cord are an artery. And when you see it come out, that umbilical cord is fat and blue and curly, and it is pumping all of that blood into the placenta that's in the placenta
Back into the
baby. That's why we talk about the cord pulsing, because it's an artery.
Right.
And so this is important because now baby is starting to use their lungs.
Right.
And so this is doing two things. That blood that was in the placenta is now the blood supply that the lungs need to push fluid out of the lungs and get the lungs going, and keep that circulation going. Most babies will do perfectly fine without that blood, but they will, if they don't get it from somewhere, they will shunt it from other places to cover their most important organs. Yeah, their most vital organs. So the umbilical cord is made that it'll keep pumping that blood out, and while it's pumping that blood out and baby's moving from fetal circulation and not breathing to breathing, they're still getting oxygenated blood into their body from the placenta, just like they were inside.
Right.
So that's a second source of oxygen if it maybe takes them a little bit longer to get their breathing going, getting their breathing established. So what are the risks of doing this, and what are some of the other things that are in the umbilical cord blood? You hear a lot about stem cells. A lot of people bank their baby's umbilical cord blood. The reason why they do this is because it's really rich in stem cells. And stem cells are these really special cells that can go into your body, and they can become any kind of cell they need to be. So they can repair damage on any cells, whether it be in your baby's heart or your baby's brain or anywhere. So that's why they're using them for research. But really nature made it that they're supposed to be getting put into your baby and stored in your baby when you give birth, not for later just in case you need them. There's also, so breast milk, and the baby's not eating the first 6-ish months of life. Breast milk has small amounts of iron that's highly absorbable, but not a lot. A lot of babies are having problems with becoming anemic in their first year of life.
Right.
That blood is actually very high in all the iron that they need to get through that first year of life before they start getting iron put into their diet from outside sources. So that's another benefit to leaving your cord intact until it's done. So the cord is made that when it's done, it actually, like she said, it goes from being that big, fat, blue, curly thing, and it slowly just shuts down and turns completely limp and white and skinny. And when that happens, you know it's done.
Right.
So we see that when you talk about delayed cord clamping at the hospital, a lot of times, not all the times, there are some providers that are doing it longer. It's like they consider 60-second delay to be delayed cord clamping. And then we see home birth midwives who don't cut or clamp the cord until way after the placenta is born. And so if you want delayed cord clamping, how do we ask for it so that you're getting what you want? So I have found the best way to make sure you're getting everything you need is to ask to wait until after the placenta is delivered, because then you know the placenta's not an active artery anymore, it's not pumping blood, you know that it's done, the cord's going to be done in white before the placenta comes out. So I've been having clients ask for that, and then even if they don't get that, they've still been getting a longer time, because it's hard to watch your clock and be like, oh, you said you wanted 5 minutes, and okay, it's been 5 minutes, or and I have seen many times providers will be like, oh, it's not pulsating anymore, but you can tell by looking at it.
There's still blood in it.
There's still blood in it and still doing its job.
Right.
So we always like to say, wait till the cord is limp and white, or wait till the placenta is delivered.
I want to say one more thing. I think one of the other reasons they used to cut the cord right away, well, I don't think I know, is they were afraid that the blood would go out of baby back into mom. So do you want to talk a little bit about that, about the physiology of the cord and how it works to shut off?
So it has been shown that some blood can go back into mom, but they've shown that the angle, so if you're holding a baby like way up in the air, way above the placenta, some of that blood is going to go back through. It can't do that once it's shut down. While it's still working, though, that blood can come back out again. So, but nature had made it so the perfect angle for that blood to work is that babies are made, their cord is made to be the perfect size so that baby comes out and goes straight to mom's chest, and usually in a semi-reclining position. You're not going to have a problem with blood coming out of the baby and going back into the placenta as the cord is steadily shutting down. Another reason why doctors may say they don't want to do that is because they're more worried about hemorrhage, but high bilirubin levels as well.
Oh, right.
Yeah. And so pathological jaundice is not caused by delayed cord clamping. That's usually caused by a difference of blood types between mom and baby. And like I said, if nature wanted baby's cords to be cut right away, it would have made it so that happened on its own. So yeah, they found that physiological jaundice, which is the normal jaundice that happens to a lot of babies, not dangerous, and it's actually can have protective properties. They found that bilirubin can actually have some antioxidant properties to it. So if you want delayed cord clamping, we suggest telling your provider about some of the research you've done, tell them how important it is to you, make it a statement, not a question, because all providers, whether they be midwives or doctors, out of hospital, they work for you. So if it's something that's important to you, it's something that you should be able to get to not have that intervention.
Thanks for joining us today, guys, and we look forward to seeing you again next week.
Yeah.
Bye.
Bye.